Hi, this is Dr. Eric Westman with another edition of Ask Adapt, and today has to do with adherence to a low-carb keto lifestyle. What are the best tips and pointers? Well, it's getting easier and easier to follow a low-carb diet. Have you noticed? There are more and more products that are available, like the riced cauliflower and cauliflower mashed already that you can purchase. You don't have to make those things on your own anymore. So the industry is coming around to providing more foods. Have you noticed the cheese crisps that are available and boiled eggs that are available at different places? So there are better options if you want industry prepared foods. And even you can eat at fast food and just don't eat the carbs. I mean, the I guess the first question for long-term adherence, what does the research say? Well, the clinical trials that were done over the last 10, 15 years showed the low-carb lifestyles at least as easy to adhere as compared to low-fat diets. In most studies, it was the same or even a little better for adherence in those clinical trials, but those don't always translate to real world kind of situations. I think the most important question is what kind of style of low carb keto lifestyle are you going to follow? The one that I teach is relatively simple, and it kind of hit me on the head when I was at a meeting recently with another expert on low carb diets, and the expert said that it was very difficult to do a low carb diet. It was very difficult to find the right place and all that, and I said no, it's actually pretty simple. So it depends what kind of style of lifestyle you're going to change. If you're going to be counting macros and use your apps and worry about the quality of the food all the time, then it can be pretty difficult in today's world. If you do a relatively simple approach where you eat is the best quality food that you can afford or that you can find, and that you just keep the carb grams low, it's a relatively simple lifestyle to follow. So the Lorianne asks what the best suggestions are to help with adherence. I think number one is re-examine what kind of low carb keto lifestyle are you doing? Are you doing one that's difficult for you or simple for you? Another question came up. Some of the things that I found Anne says are alternatives, like she didn't want to drink skim milk anymore, so she found the almond milk or unsweetened almond milk. Is this a problem? As I'm branching out in foods, my weight loss is slowing, and I want to make sure the almond milk's not the culprit. Well, I do think that the number of total grams of carbs is the first thing to address. And I've had a lot of people using unsweetened almond milk just fine because it is low in carbs. While it's not technically on page 4, meaning historically almond milk hasn't been available, maybe it does do something different that we don't know about. That's where your individual detective work, where you only change one thing and try it for a week or two to see if it makes a difference. And then ask, is there any scientific reason not to use Splenda or sucralose or let's say any other non-sugar sweetener for that matter? No, I think the overarching idea is you want to avoid foods and drinks that raise the blood sugar or that impact the ketones. And a lot of people can have those non-sugar sweeteners and do just fine. If it turns out that that's a problem for you, then don't have it. But I think that's a minor player compared to the total grams of carbohydrate. Debbie asks, what are your suggestions for making this a lifestyle and not a diet? Well, in the lifestyle medicine world, or if you adapt your life, not just your food that you eat, the 3 principles we look at are nutrition, activity and exercise, and stress management. And so one big theme through being in an obesity medicine practice for over 10 years now is the therapeutic use of food. Some people call it emotional eating. Well, I think you should think of it as therapeutic eating. It's actually providing a sort of drug-like effect to treat the emotions. And if that's really one trigger for you to go back to the carbs, then you really have to address a different type of stress management technique that's not related to food. So we work on that in the clinic after, after the weight is down and people get a good handle on the food. We do address the activity and exercise and also the stress management domain, and that really helps make it a lifestyle rather than just a diet or the food. Simon asked, do you find that folks are able to stick to this for life? Do folks need to stick to 20 total grams, or can we go into some sort of maintenance program? Well, Simon, that's a great question. And yes, people can stick to it for life, but then you don't have to necessarily. When I teach this, someone coming for weight loss or diabetes reversal, I'll explain that this is a technique to get you to a goal, and then you can decide what to do at that point. There are a lot of people who do choose to eat this way and live this way for a lifestyle because they just feel better. And actually the emerging research is showing that it's better and better, not worse and worse. So it still remains to be seen. It may be better to actually not eat sugar and starch very much at all for a lifetime. We don't know. 10 years ago, we thought that it was going to be necessarily bad, and now it actually looks better. The ketones have therapeutic effects, anti-inflammation effects, and now it's being studied for these chronic diseases like Alzheimer's and cancer. And so I'm not afraid of keeping someone at that low a level. Every now and then, some people do maintenance every now and then, having carbs, and then just getting back to the low level, or some people add back a little bit every day. A lot of individual variability there depending on your age, your activity level, and your just individual metabolism. Bev asks, what's the biggest reason that people are not able to adhere? And, I would like most people to think about this in terms of carbohydrate intolerance, so that if you're even to the point of addiction, I think that's the main reason people can't adhere, is that they've been exposed to this drug-like effect of sugar. It's almost like a drug, like smoking or alcohol, and that's a hard thing to get out of for a subset of people. And I think that's the biggest reason that people can't adhere to it. So another important part of this is learning, and my job is learning to expose people to really tasty foods. This is not a depriving kind of way of eating. If you're thinking about the opening up of all these other foods like pate and liverwurst and things that you might not, and eggs and bacon and things you might not have thought that you could have. And so I remind people about that. Finally, the support system can be very helpful. Either you have friends or family helping you, you go to a local support group. There are more and more that are popping up. There's a movie called The Magic Pill, where local gatherings are getting together in movie theaters to watch this movie that's about the keto or ketogenic diet. And now social media has so many different support groups. You can drill down to exactly the type of support group that you want. And that's very helpful these days to get you started, and then for long-term maintenance. So you see that you're part of a group that's doing this. It's not just you anymore. So that's the take on long-term adherence for the low-carb keto lifestyle. I hope that's helpful. Please subscribe below if you haven't already, and till the next time.